I welcome you from Estonia, and as I'm a replacement, so I'm sorry, some of the colleagues have heard already my presentation and they are allowed to sleep from my side. So what I'm trying to present is what we have done in Estonia in the quality field, and I am a full-time GP and a member of the board of Estonian Society of Family Doctors. And my field is the quality field. So just the background for you to know. Estonia is a small country and there are only 1.3 million inhabitants. And we have the GP system already approximately 20 years, gatekeeper frontline system. And I also mentioned the payment system, but we have the mixed payment system. As you see, 80% per capita. We work on the list basis on the list of patients, and the number of the patients can be 1,600 plus minus 400 principally. With a helping doctor, you can work on the list until 2,400 patients. Okay, and we are private. And our services are bought by Estonian Health Insurance Fund, which is statal. And we have 468 GP-led clinics, and as you see, lots of them are mono or solo practices. And we have 805 GPs in Estonia. We have quite a strong society of family doctors, only one society of family doctors, and more than 700 GPs are related to society, so majority is involved. About the quality of practice and quality of therapy. We have the existing system from 2006, which was the 1.2% of our income, and which is having the quality of therapy field. And it's consisting of the prevention, the management of chronic diseases, gynecology, surgery, pregnancy follow-up. From 2009, the Society of Family Doctors produced a standard guideline. We started with the Australian and UK standards and wrote our own because they didn't match to our system properly. And so we had the guideline how to do well, and it was done with the Tartu University because the leader of the Society of Family Doctors in that moment was the professor of family medicine from Tartu. And Tartu is our own medical faculty, own and only. So why? Yeah, we have, as I said, we have the private practices. And they get the same financing everywhere. Just in the rural practices, they get some support for the distance. And there are really varying quality of therapy and varying quality of running the practice. And we needed to analyze where we were and to start the plans how to do better. And so in this document, what I showed in a blue book, this is the text document, and it describes the standards. The standards principally are covering all these things what were discussed today in the morning, and starting with the team meetings and organization and access and all these things. And in this text documents, there is also a table of indicators and the questionnaire of patients' backfeed, just to use as an example. And additionally to this text document, we have the digital table in Society's intranet. The intranet, this is our local visit tool, or our local tool to assess the practice. Where and how is it going? So parts of the text document. The first is access. We don't mean only the doors, of course, but all kind of accesses, how the patient can connect to the practice. The second part is the organization of practice work, including all the situations. The third is the quality of medical treatment. And the fourth is the practice as base for studying and science, including all steps, doctors, nurses, and in the future, all clinical assistants. So the digital table or digital tool is, we have the period of 1 year. As I was hearing, most of reasonable countries do it in 3 years. But we have the period of 1 year, it makes it quite workly. But our digital tool is open from autumn to spring. It's voluntary for the practice to put the data in, and you have to mention, there are the indicators, 20 indicators written, and you get the score if you have finished the data input. So on this basis of the score, the computer will count where are you with your practice. And this table is closed for the patients because we just want to use it for development, not for criticizing or finding out who is good and who is bad. It's closed and open only for society family doctors. So after the finishing the period of input, data input, the auditing will start. And the auditing is also done by the members of Society of Family Doctors with these processes, pluses and minuses. And the first time in that year, we also asked to participate one of the one of the outside auditor, and it was a good success, so I think we are widening it up. Okay, and the only benefit in that moment is the honoring of the better A-level practices. So the data from the first year audit, so now we have done 2-year audits. So first year, the practice is taking part of the inputting their data, and the number was 79, so the total number was 468. So, and to the A-level graduated 18 practices. And on the first year, we were afraid of amount of auditing. And we took only several practices to audit, choosing one in the city, group practice, one in the country, small practice, trying to get the picture. And it was very interesting. Result was that all the practices almost all the practices qualified, and we did the changes for the next year because it was the first year and we didn't know where we are going to fall, and we changed the protocol for practice auditing somehow. And for the next year or this year, already the 1/4 of the practices were taking part of the accrediting A-level practices. In the beginning were 29. We audited all the practices this year, the A practices I mean, and 5 of them lose some points. So the result was that the 24 practices qualified to A-level. There was an honoring process because inner motivation in Estonia is a good thing, but some carrot could be. And the honor is one part of carrot. I'm sorry, I'm talking about money also. We are trying to negotiate for the money for the better practices. I know I'm unpopular with that. But still the negotiations with the Estonian Health Insurance Fund or insurance part, they say that they are just interested in the quality of therapy field. Thank you, no more. The Ministry of Health and Social Affairs says that, okay, you just have to require the minimum requirements. This is it. If you want to do better, thank you for that. So we are going on with that, but I think some money for good work could additionally given. at least the possibility to have a possibility to talk about better contract with your insurance fund could be a bonus. So this is the award what we give, and I think I hope after 20 years the small marks will be filling all this blanket. So lots of pluses and minuses in that system, but I still think that the organization is important. Thank you.